I have my regular insulin vial and my NPH insulin vial. I'll begin by verifying the provider's orders. Then I'll verify the 6 rights of medication administration, which are right patient, right medication, right dose, right route, right time, and documentation. I'll check the medication orders in the MAR. The provider's orders reads, give 4 units of regular insulin subcutaneous and 8 units of NPH subcutaneous every morning before breakfast. I'll compare the MAR with the names of each insulin vial to the medication labels and with the patient's name. I'll then gather my supplies and proceed into the patient's room. Upon entering the room, I'll close the door to ensure patient privacy, place my supplies on a clean, dry, flat surface, and introduce myself to the patient. Hello, Mr. Smith. My name is Bessie. I'll be your nurse. May I see your wristband? Thank you. Can you please tell me your first and last name and your date of birth? Thank you. Now, Mr. Smith, do you have any allergies such as certain foods, medications, seasonal, anything like that? No? All right. Sorry. I'll then perform hand hygiene and apply clean gloves. Okay, Mr. Smith, your provider has ordered you to take 4 units of regular insulin and 8 units of NPH. I'll be combining these 2 medications into one subcutaneous injection. First, I'll review what they are, how they work, what they're used for, common side effects, and adverse effects. Now, adverse effects require immediate attention, and if you experience any of these symptoms, please report them immediately, okay? All right, first we have regular insulin. This is an anti-diabetic short-acting insulin. It works by replacing the insulin your body would naturally produce. It helps move glucose from the bloodstream into cells to be used as energy. It's used to manage blood sugar levels during meals and is injected subcutaneously about 30 minutes to an hour prior to meals to control the rise of blood sugar that can occur after eating. Common side effects are shakiness, hunger, possible swelling, itching, or redness at the injection site. Adverse effects could be hypoglycemia, seizures, or lipodystrophy. The next medication is NPH. It is an anti-diabetic intermediate-acting insulin. It works by helping regulate the blood sugar level. It works by helping regulate blood sugar levels over a longer period compared to regular insulin. It has a slower onset and a longer duration of action. It's used to provide basal insulin coverage throughout the day and night. It helps manage blood glucose levels between meals and overnight when the body's insulin needs are lower. Common side effects are weight gain or water retention. Adverse effects could be hypoglycemia, irregular heartbeat, vision impairment, or confusion. Now, just so you know, you might feel a slight stinging or burning sensation when I administer the medication. Do you have any questions? No? All right. I'll now check the patient's blood sugar level. For this example, the patient's blood sugar level is reading at 180, and his next meal is scheduled to be breakfast in 40 minutes. I now have another RN with me. I'll check the medication orders in the MAR. 4 units of regular insulin and 8 units of NPH. I'll be combining these 2 medications into one injection. 4 units plus 8 units equals a total of 12 units. I'll verify in the MAR 4 units of regular insulin 8 units of NPH, a total of 12 units. The other nurse verifies. I'll now roll the vials between my hands. And wipe each top with an alcohol swab. Now I'll take my syringe with the cap still on. I'll pull the plunger line down to 8 units to what the NPH medication will be administered. Eight units. Now I'll remove the cap, insert the needle into the correct NPH vial, making sure that the tip of the needle does not touch the medication solution. The tip of the needle has not touched the medication solution. I'll now insert the air into the NPH vial, and I'll remove the needle, making sure not to aspirate the medication after withdrawing. Now I'll pull the plunger line down to the 4 unit measurement. To inject into the regular insulin vial. I'll invert the vial, inject the 4 units of air, and withdraw 4 units of regular insulin. Making sure not to overdraw the medication. Once I withdraw the needle, if I notice any air bubbles, I'll tap on the syringe and push the plunger forward gently to remove any air bubbles. I have 4 units of regular insulin drawn. And then I'll verify in the MAR of the amount of regular insulin, 4 units. The other nurse verifies 4 units. Now I'll confirm the combination of medications of both insulins into the syringe. I currently have 4 units of insulin. I'll verify in the MAR 4 units of insulin and 8 units of NPH, totaling an amount of 12 units of mixed insulin. The other nurse verifies. I'll now insert the needle into the NPH vial, making sure not to inject any of the insulin already in the syringe into the NPH vial. Now I'll invert the vial and withdraw 8 units of NPH, making sure not to overdraw the insulin. Then I'll withdraw the needle again, making sure that if I see any air bubbles, I'll tap the syringe to cause the air bubbles to go up and gently push the plunger forward to remove any air bubbles. I have a total of 12 units of mixed insulin. For my safety and for the purpose of this video, I'm going to recap the needle. After I've collected the insulin, I'll I'll recheck and verify that the dose that I have in the syringe matches the dose in the medication orders of the combined dose. 4 units of regular insulin, 8 units of NPH, a total of 12 units of mixed insulin. I have a total of 12 units of mixed insulin in my syringe. The other nurse verifies. If I had drawn up this medication away from the patient, I would label the syringe with the insulin types and the doses.